Hello, my name is Dr. Jonathan Clavell, urologist and penile implant expert in Houston, Texas. Today we have a special guest, someone who lived through the experience of undergoing penile implant surgery just a few months ago and has kindly agreed to walk us through his whole story, how he lived with erectile dysfunction, the emotions and questions before surgery, what recovery was really like, and how his life has changed since then. We'll keep this conversational and practical. No scripts, just an honest patient and doctor perspective to help others understand what to expect. And now to the episode. I'm excited for you to be joining us today, that we can have this conversation. I know how difficult it can be, because I see it every day with my patients, how difficult it can be for some men to open up about their most intimate parts, right?
Yes, it is.
And so first, for everybody who's listening, can you introduce yourself?
Yes, my name is David, and I'm 67, and I've suffered with this since I was 55.
Suffer with what?
ED.
Erectile dysfunction.
Yes.
And you said since you were 55?
55.
55, so for 12 years.
Yes.
Okay, and what happened? Like, how did that start? What did you start noticing?
The lack of being able to hold an erection. I went to a doctor, and he gave me Viagra, 100 milligrams, and I was great then.
How long did you try the medications for?
A month later,
A month. Okay,
nothing.
got it.
I didn't get anything. And I went to see my urologist, and he performed a scope, which I'll never do that one again. But anyways, after the scope, I had back surgery, and there was some scarring, so he took care of that.
And you had some back surgery?
Right.
Okay. With the back surgery, I'm assuming that was not done by the urologist?
No.
Okay.
So with that, I had some scarring on the inside, and he took care of that.
Of the penis?
Right.
Got it.
So once he got finished with that, I started getting a mild erection again.
Okay.
That disappeared within a month.
Okay.
I stayed on the Viagra.
So this was all 12 years ago?
Right. So I stayed on the Viagra and nothing. So I ended up not being with any females I haven't been with a woman in 13 years.
Okay.
I stayed away from it. I was ashamed.
And tell me a little bit more about that. Like, why did you feel ashamed?
Because I couldn't function. There was nothing I could do for her. And I didn't want her to shame me. So no matter how much I had the urge, there was nothing going on down there at all.
So the urge was still there, the arousal was still there. I mean, you wanted to.
Oh, yeah.
It's just you were not able to perform.
Just not able to perform. And one day I went to see my urologist, and he said, look, I can't do nothing for you anymore, but I know someone who can. And I said, I looked, it's kind of concerning. And I said, well, who? He told me about Dr. Clavell.
Okay, so basically that's when they told you to come see me.
Yes.
Okay, but we're talking about 12-year span, right? So 13 years. I started everything at 55.
Right.
Medications, you said that they started and they worked for about a month or so.
Absolutely.
And what happened? I mean, were the medications, did you have any side effects with the medication?
No, I never had any side effects. There was just nothing going on.
So you were not able to gain the erection?
None at all.
And was it something that gradually got worse, or like all of a sudden?
It was like 55. It was pretty good. Then when I turned 56, it started gradually starting to decrease. And then once I hit 57, it was gone.
That's when everything kind of went.
It just nothing.
And then, quick question. like back then when you were 55, were you in a relationship or were you single? Like what was your relationship status back then?
I was seeing someone back then, and it was kind of hard because, yeah, I had to take the Viagra and go. And
Did you feel like things were not spontaneous?
no, because they say when you take Viagra, a woman touches you and up you go. Yeah, that ain't happening. That wasn't happening. It took a lot more than that for her to get there. I mean, she was sexy, she was vivacious, but yeah, it took a lot more than that. The sensual touch, the arousal, yeah, I couldn't feel it.
Okay.
Not down here.
Not down there.
I could feel it here, but not down there. I don't care what she did. It just wasn't happening.
And I'm guessing that's what you mentioned, like you were ashamed
Ashamed.
in the moment. Like, what did you feel when that happened?
I got up and left. I went home and I sat
Long
there.
trip back home?
Yeah, I was in thoughts. Life was over.
Mm-hmm.
Then when she called and said, "Well, come back over, let's try again," and it was like, "No, I'm not." Well, it's going to be all right. No, it's not. It's not all right. It's not ever going to be all right. Because I thought I was going to be subject to taking these pills, but everybody kept saying, "Oh, it's your age. It's your age. Your age is doing this to you." And I kept thinking, it can't be. It just can't be my age. I know too many guys way past my age that are just having all the glory in the world. I don't believe that. And then I met Dr. Barnes, and Dr. Barnes said, "Well, let's try this."
And Dr. Barnes is your urologist.
Right. And he said, "Well, let's try other avenues." So we tried the scope. And
Did they ever mention anything about trying injection therapy?
yes.
Did you try that?
No.
Okay. Why not?
No.
The thought of the penis and injection.
No. Taking the pill was one thing, but no.
How about a vacuum erection device, or sometimes we use a vacuum erection device with a constriction ring. How about that?
No, that never came up. Even though I've heard of it before, but it never tried one once. Just as a gag gift.
And now we're talking about you are 57 years old, and there's a gap of 10 years.
Yes.
What happened during those 10 years?
Nothing.
Were you seeing Dr. Barnes during those 10 years, or did you go to
Yes.
see Dr. Barnes afterwards?
Okay. I was seeing him within that period of time.
Got it.
And my state of mind was declining.
How do you feel erectile dysfunction affected your day to day? Did it affect your relationships with friends, with family?
With guys, I was okay.
Okay.
Around females, no. Guys, you can joke about things. You can even discuss it, and they just go, "Ooh,"
Did you ever tell any of your friends?
Not everything, bits and pieces. I tell them, "Well, I go see a urologist," but never tell them why. I have a sister, and I tell her, and she's like my mom, but I really don't want to hear this. Well, you're the only one I can talk to, so be quiet and listen. So that's the last family member I have. So I make her listen. So she's kind of going, "Okay, do I really have to hear this?" And I'm going, "Yeah, I need to talk to somebody.
Good.
If I don't talk to somebody about this, I'm going to crack." And she went, "No."
Why do you mention you were going to crack? How so?
Depression was really starting to
Kick in.
And my anxiety was really high, to the point where my job, I'm a daily operations manager. I work with 37 men that come out of penitentiary that I teach a better way of life. No, the anxiety, you don't. It's like, shut up. Get away from me. I don't want to talk to you, And then they're going out on dates. and then you start gritting your teeth. Oh, why don't you go out? I want to go out.
Come with us.
Yeah, let's go ahead. Let's go do this. Let's go. No, that's
So this was also impacting your social life.
Oh, very much
significantly.
So. Yeah. And in all due respect, I've done this job for 12 years, and I've been nowhere. I haven't gone out in 12 years. I haven't gone to a club, bar, gone out to eat, done nothing. I stay in that building 24/7.
At home, you mean?
Yeah. Because I don't want to go anywhere. Because I don't want to get that feeling and not be able to perform. I don't want to go out and meet a woman and get happy about it and then not be able to do anything about it. Then come home and look at myself in the mirror and go, you're useless.
But that, I mean, did anybody ever tell you that, or that's how you felt?
No, that's how I felt.
Got it.
I really didn't know. But, family members would say, well, you're not useless. It's just the way life is. Life isn't that way.
Your sister would tell you that, because that's just your...
Life isn't that way. I can't accept that. There's got to be something that can get me back out of this depression.
And that's when you spoke with Dr. Barnes, and he told you to come see me.
Yes.
Right.
Yes.
And then do you remember when you came in for the first time? Like, how was the process of you?
When I came in, I was nervous. It was like, okay, here we go. Are we going to find somebody that can help me, or am I going to hear this? Well, Mr. Padilla, you're getting old. Maybe it's time for you to, not worry about that kind of thing no more. And I said, I grab him by his shirt and shake him like a tree limb if he tells me I'm getting too old. But I was really nervous. Matter of fact, I sat right over there.
Okay.
And my knees were shaking. Pretty good. Till I met you. I watched film, and you asked me, what do you want to do? And I said, I want everything.
When you came in, did you already know that you wanted the penile implant?
No.
Okay.
Not until I saw the film.
Got it. So basically you came in to our office just looking for options.
Right.
Got it. And then when you came in, there was a video on one of our TVs. I'm assuming that's from our YouTube channel.
Right.
Okay. And that's when you started hearing about it.
Yeah, I started listening to what you did, what you said, and how you talked about it. And I thought, getting cut down there. Okay.
It is a lot. It is a lot. It's a lot to think about.
Yeah. And then you came in and we talked, and I felt a weight lift, and then I felt some excitement that maybe if I get this done, man, I'm going to have my life back. I'm going to have my spirit back. And yeah, you did that.
And going back a little bit, I mean, I just want to know more about, your medical conditions. There's many guys out there that they don't know if they have, why they have erectile dysfunction. Some of them have diabetes, some have high blood pressure.
I got all that.
You got all that. Okay, so you have diabetes?
I have, yeah.
And you have high blood pressure?
Yeah.
Any problems with your heart?
Nah.
No? That you're spared?
Yeah. Yeah, my heart doctor, he puts me on the treadmill, makes me run.
Okay, and you pass the test?
Yeah, I got a heart of an 18-year-old.
So you said you are diabetic, you have high blood pressure,
yes.
And that is very likely the cause as to what led to erectile dysfunction. And most of the time it's something that, starts out fairly gradual. Medications initially work, and eventually things start,
Right. But I didn't have diabetes when
you were 55?
Right.
How about high blood pressure?
I had the high blood pressure.
Okay.
When I found out I was a diabetic, I turned 63.
Okay.
And then I found out that I'm borderline.
Okay.
I'm not complete diabetic.
Okay.
I'm borderline. I'm like 6.8.
Got it.
But now I'm 6.3.
Oh,
So,
now you
yeah,
now you're a stallion.
yeah. So, I mean, you get to really understand what's going on in here,
Hmm.
and in here, everything has changed. I'm not depressed anymore.
Hmm.
My anxiety's gone.
You mean now?
Yeah,
Okay.
and my desires have grown immensely.
Hmm.
And I do have a fiance, and she's excited. And
Hmm.
I told her about the whole procedure.
Great. That
Uh,
and did you speak with her prior to the surgery?
yes,
Okay.
and I explained to her what was gonna go on,
What
and
was her reaction
she said,
initially what did you speak with her after you spoke with me in the office?
yes.
Okay. And what do you tell her?
I told her that I'm gonna have surgery down below,
Hmm.
and she said, down below where? And I said, I'm gonna have surgery on my penis,
Hmm.
so I can be able to make love to you.
Hmm.
And she said, okay. She said, is it what you want? And I said, it's not just what I want, but I want to be able to satisfy you. I want you to not look elsewhere. When I marry you, I don't want you to think that I have ED and I can't perform anymore, and I don't want you looking anywhere else. I'm the only one that you need to look at.
Hmm.
I said, I told her I'm a Spaniard.
Hmm.
Mhm.
And it's interesting that you mentioned that because I see that a lot in my practice in my office. Some guys say that, or some guys not. Sometimes guys come in with their partners, and the partners sometimes feel like men are getting this procedure, a penile implant, because they want to satisfy themselves. And there's a big misconception because usually whenever I ask a guy, if I ask you like, what is your goal? You tell me what would be your goal with the penile implant.
My goal is, it's not for me, it's
Hmm.
for her. I don't want her to not be satisfied.
Hmm.
I want her to be beyond satisfied. I want to be able to look over and see her shaking and vibrating.
Hmm.
I want to be able to blow air onto her skin and watch her wiggle. I want her to understand that what I didn't do for me, I did for her.
Hmm.
I want her to feel things that she's never felt a day in her life.
And that's usually what I see in my practice. And I'm glad that you're able to express it that way because, again, as the doctor, many people don't believe me. And hearing it from somebody who lived this situation, I'm glad that you're able to share that. Because, again, no, I'm so happy you just mentioned that. Because unfortunately, many people think that yeah, like men are doing this for themselves, and they're not. They're doing
No,
this usually to satisfy their partners.
it's especially men who are married,
Hmm.
okay? And I feel them. I feel them a lot right here.
Hmm. How so?
And because I understand and feel what they're going through with ED. And I know that they sit up at night and their wives are just cringing at the fact that they're not getting made love to. And they're sitting on, I can just picture them sitting on the end of the bed going, it's over, it's finished. I'm going to lose her. I'm going to lose the life I built. What do I do? How do I, how do I get the help? And this is the help. This is the solution. This can change everything. Okay, yeah, I gotta pump it up. I don't care. You know,
How long? Big question. How long does it take you to pump it up?
5 minutes.
Okay, 5 minutes.
Yeah, she can't wait 5 minutes. Then she's wrong. Okay, it's and I've told my fiance, and my fiance is Latina, so
Hmm.
and yeah, she's
You have a
very
higher bar.
yeah, yeah, she's very vibrant. She's 48, so yeah, she's patting her foot and waiting. So I'm going to give her what she just deserves.
Great. So going back a little bit again to prior to surgery and when we were deciding to get the surgery done, we had that initial consultation. You saw the videos. You and I spoke, right?
Right.
Do you remember how long our conversation was? I don't remember.
I think it was about 30
Yeah,
minutes.
usually it's about 20, 30 minutes. Okay.
Yeah. And
Did we talk
you,
about the surgery right there and then?
yes.
Okay.
it was, do you want to do the surgery?
Mm-hmm.
Are you sure you want to do this? And I went, yes.
Do you felt, I mean, this is just me being curious. Did you felt like I was pushing you for surgery?
No. I felt, because I look in your eyes,
Mm-hmm.
and I felt, okay, he knows what he's talking about.
Mm-hmm.
Okay. I have faith in God. God brought me to you. And now, looking in your eyes, I know that he put me in the right place, and you're going to do right by me. So yes, I'm ready. Let's do it.
Awesome. So, and then what happened? What happened then? Did you speak with our scheduler, or did you
Yes.
go home and then call us back? Like, how
No.
did it go?
No, I went straight in and spoke with the scheduler and got it all set up. And after everything was set, I went home. I was called for, matter of fact, sent a text message for the date
Mm-hmm.
and time.
Did that get you nervous?
Yes. Got real nervous because I went, oh, here we go. So I always get nervous before a surgery anyway.
Mm-hmm.
So I said, okay. And then all of a sudden we were thinking about maybe the 19th or the 20th. And then all of a sudden, bam, it's the 14th. And I went, here we go, quick, here we go. So, yeah.
And leading up to the surgery, did you do any more research? Did you kind of like read more on this? Like,
yes, I did. I was given a pamphlet,
mm-hmm.
and I read, and it had dealing where you could hear other men speak on
Mm-hmm.
the subject.
Okay,
so I listened to what they had to say, and it was very inspiring. And I said, okay, I've already committed myself to this. Okay, we're going to do this and see how it goes.
And preparing for surgery, like, do you remember the day before surgery?
Yes.
How did that go?
Yeah.
Were you a nervous wreck?
Man, I'm nervous. I left my ID at the house. It was just a good thing I had photocopies on my phone because I left ID, I left insurance at the house, and I was nervous.
And then would you wake up the morning of the surgery? I'm assuming that you kind of like did the wash that we usually tell you guys to do the wash. And when you arrived to the hospital, we did your surgery in a hospital, correct?
Yes.
And when you arrived to the hospital, like what was your perspective the day of the surgery? How did it go?
The nervousness died down a little,
Mm-hmm.
but I was anxious to get it started, and went up. They got me set up, put the IV in, and my boss, she was there.
Okay.
So she has to be everywhere.
So your boss was the one who accompanied you to the
Right.
surgery.
Yeah.
Okay.
So
I remember that. I didn't want to mention that, but
yeah.
I remember that.
That's okay. I told her I was doing this anyway. She accompanied me. She pat my hand. It's gonna be okay. It's gonna be okay. And I'm fine.
And how was the experience with the staff, for example?
The staff was great. Very friendly, very knowledgeable, and I appreciate that.
They made you feel comfortable?
Yeah, they didn't make me feel, like I was an outcast or anything like that. They were good people. All the ladies were nice, and I enjoyed their conversation.
And you had the surgery.
Yes.
And then after surgery, what happened? Do you remember anything after surgery while you were there in the hospital?
Yeah.
What do you remember?
When I woke up, I went.
You looked down there?
Yeah.
What did you see?
A big white bandage, and then about that much sticking out the top, and I went, oh Lord, that hurts. And I said, and I was like this, and the nurse came in, and she goes, well, let me see, and she threw the blanket
on top,
sheet back, right? My boss went, uh-oh, and covered her face. So it gave me something to laugh about. That took my worry away for a moment.
Did you have pain?
Yeah, I had pain, but it wasn't anything that I couldn't handle. I had flashes. It was like, it wasn't straight pain. It was like would be okay for 1 minute, and then I'd move, and it would go boom, and it would hit me, and I'd go, whoa.
Was
okay.
it in the penis, or the scrotum?
Right.
Okay.
It was always in the penis.
Mhm.
It was never in my scrotum. I never had pain in my scrotum because it would always shoot from the base of my penis and go up.
Go up. And yeah, and usually that's what we consider neuropathic pain. It's very common for that to happen whenever we do this surgery. I mean, I always explain to my patients that your penis is undergoing the biggest trauma of its lifetime, right? We're placing a device that's inside, and sometimes the pressure can cause shooting pains, and we do give medications to help things calm down. We usually put in a block to kind of like numb things down there the first few days. You didn't feel that?
No.
No.
No. I was, my head was someplace else. Of course, I was kind of going, feeling around, and I was going,
I can feel it.
This is a cage. You know? And I thought, how did he get all that in there from that little incision?
Mm-hmm.
And that's
okay, but that's with the dressing on, you mean? Or that's
after I got the dressing on.
The dressing off.
Yeah, and it was like, how did he build all that? Because it's way down here and it comes way on the side. And I was like, how did he do that?
Do you remember the incision? How big it was?
Yeah.
The incision was that big. The incision about this.
No, it's about like that. He goes, yeah, it's about like that.
Okay.
How did you? Well, how did you get all that in there?
I mean, we try to keep our incision as small as possible, and
yeah, but you put a lot of stuff in there.
We did put a lot of stuff in there. That's right. In order to get things going. Remind me, did you also have any curvature or anything like that?
At first it did.
Mm-hmm.
And
that's probably why the incision was a little bit longer.
Right.
Because it was, whenever there is, curvature in the area, we sometimes have to kind of like manipulate things.
Straightened out.
Exactly, to get it straightened out.
Yeah.
And that's very common, again, given that you had erectile dysfunction for so long, sometimes scar tissue can start building up and it can cause that. So that first week, I want to know more about your recovery itself. Like before you came in to see me for the follow-up, that first week, were you able to walk?
Oh, yeah.
Okay.
Oh, yeah. It felt funny. But
Okay.
yeah, I was able to walk.
How was your sleep?
I flip-flop.
Okay. How so? Uncomfortable because you had a partial erection, or uncomfortable because of the pain?
No, because it was partial erection. I didn't want to land on it because I didn't know the effect. So,
are you a side sleeper, or do you sleep on your belly, or do you sleep facing up?
On my side.
Okay.
And when I roll, I don't roll like this. I roll the opposite direction. So I'm going, if I'm on my left side, I'm going to go around this way. So it's, I got a flip-flop. Did
you have to wear like a pillow in between your legs or something?
No.
To kind of like, no?
Okay. No. I didn't wear pajamas.
Okay.
Everything was in the buff.
Okay. So you were freelance. You went commando at home.
Absolutely.
Not even a robe?
No. No.
Did you have to ice yourself? Like anything that helped you recover, or do you think helped you recover?
No, none of it. I just let nature take its course. I followed the instructions that were given, and when it was said 2 weeks, 3 weeks, I believe, 2 weeks, and take a shower.
No. You could take a shower 2 days.
Yeah, well, 2 days.
2 weeks. I would be concerned if you did not shower for 2 weeks.
2 days, and I took I went in, and I didn't want to pull the tape, so I took a shower and let the water do the work.
Good.
And I was like, wow.
And when you looked at it, what happened when you took your dressings off? What was that impression when you looked down there?
I said, uh-oh, they're in trouble. Oh, they're in so much trouble. And then I reached down, I pulled it up, and I looked down, and I said, oh, dang, he cut me. And, I said, oh, I hope that scar disappears. So,
did it disappear?
Yes, absolutely. Yes.
How long did it take for that scar to heal?
About, it's been 3 months. Yeah, about that.
Okay. So now it's like you cannot tell that there's anything was done.
No.
And usually that's why I tell people, it's like it can take, for a scar to anywhere in your body, for a scar to fully heal takes about a year. But usually by 6 weeks, it's very subtle, and by the 3-6 month mark, that's already kind of like there's no way for you to see anything down there.
Well, my fiance told me, she said, "Oh, don't worry, it's character." I said, "Okay, in your opinion, it's character. So you don't have to carry it." So.
And question, in terms of pain, when did the pain start getting better? You were able to carry on with your daily activities?
About I'd say about a month.
Okay.
I wasn't wearing pants.
Mm-hmm.
I would wear pajamas
Mm-hmm.
or sweatpants.
For that first month.
Right. And it was a little uncomfortable
Mm-hmm.
because the material would rub up against it. And
basically the head of your penis, I'm assuming, was rubbing against your,
Right. And it was just a little uncomfortable.
Were you able to tug it inside your underwear? But you said you didn't.
No.
Did you try to leave your house in that month? You
No.
were inside your house for a month?
Yes.
Okay. Well, previously you were inside your house for 10 years and
Yeah,
barely leaving. Okay.
But going to the store or something like that, no, I wouldn't go.
Got it.
I'd have one of my clients go for me.
Got it.
Within that month. Then the second month, I got a little braver.
Mm-hmm.
And I put underwear on.
Mm-hmm.
And I put a pair of jeans on. And it was getting used to the hands.
When did you start cycling your implant, like getting it up and down?
Close to...
Usually I tell my patients 6 weeks.
Right.
Was it close to that, or was it before you saw me?
It was a little after.
Okay.
After the 6 weeks.
Mm-hmm.
I was kind of nervous about it, and
Mm-hmm.
I didn't know how to make it work. I kept pushing the button,
Mm-hmm.
thinking that was making it go up, and I was thinking, man, it ain't going nowhere. I said, this sucker's broke. So, and then I looked at the card, and I carry the card in my wallet.
Mm-hmm.
So I looked at the card, and I said, oh, you got it. Oh, okay. So I reached down, and I squeezed, and it went, and I went, oh, yeah, this is going to be fun. So after I got it to stand and rise, I felt, a twinge of pain.
Mm-hmm.
And I thought, okay, that's just because of it not being used to it.
Exactly. I mean, you have a device that right now you're not trying to expand the tissues.
Right.
And it can cause a little bit of discomfort.
It's got to get used to the expansion. So I would pump it up until it would get to the point where it hurt too much.
Mm-hmm.
And then I'd let it set.
For how long?
For about 2 hours.
Oh, wow. Okay. And usually I say 20, 30 minutes, but you went all out.
About 2 hours, and then I'd let it go back down.
Okay.
And then I'd go, but I'd let it go back down, and then I wouldn't touch it for a couple of days, and then I'd come back and I'd do it again.
Did you find any specific activity or maneuver to make it easier for you to cycle, basically inflate or deflate? For example, I tell my patients to get into a warm bath. Do you try that?
No.
No. Okay.
I take a shower.
Warm shower?
Right.
Okay.
I try pumping it. It's okay. I like laying on my back and doing it. It's a lot easier. That way, my knees are up and I can watch it rise. So that tickles me to death. So.
How did you feel the first time you were able to pump it up to the max? Like, did you feel the bass? How did it feel?
I haven't gotten it all the way to the max yet.
Really?
But yeah, no, not yet. Because the bass is really hard.
Mm-hmm.
But once it gets up a little bit further, it's still kind of soft.
Mm-hmm.
So I figure, I'm still in process, still healing, and still getting everything done. I figure once all that's done, it's going to go all the way, and it's going to be, because I'm a whole lot bigger than what I thought it was.
So I know, and that's usually what happens. Usually, whenever, especially, so you're still early on. It's only been 3 months from your surgery, and whenever you do pump it up all the way, it is very common for the base to feel like really, really strong, and then beyond, like closer to the head, to the tip, that doesn't feel like a rock, and we don't want it to feel like a rock all throughout, because otherwise your partner will feel a rock, right? We want them to feel, we want them to feel a penis, right?
Right.
And In terms of the shape, what do you feel about that? Any changes in terms of the shape?
Yeah,
What?
there is a difference. There's a good difference.
Tell me.
Right now, I would say I'm about
Don't say numbers.
I'm about 2 fingers.
Don't brag.
2 fingers in width.
Okay.
Okay. When it's pumped up all the way, I'm 3 fingers in width.
So to expand in terms of girth.
Absolutely.
Great.
So the girth is a whole lot bigger. I'm not upset about it. I'm pretty excited about both length and girth. It's more than I expected.
How about the sensation, the feeling? Does everything? How does it feel?
Oh,
Physically, I mean.
it absolutely fantastic.
Okay.
I haven't had a ejaculation
Why not?
yet because
Because you're waiting.
yeah.
Okay. Because you're away. I mean, you were mentioning earlier that your partner, she's out of town,
Right.
and you're.
Yeah, I'm building that one up.
Okay.
Yeah, that's gonna. Yeah, that's why I got to.
And you haven't even tried self-pleasure?
No.
Not yet? Why not?
I thought about it.
So even without you having the full experience of sexual pleasure, be it with masturbation or with a partner, you are excited about this?
Oh, extremely. Now, I'm not going to say I haven't masturbated, but I haven't ejaculated.
And when you masturbate, how does it feel?
Oh, fantastic.
So it feels normal. It feels good. Normal.
Yeah,
Sensation's still there.
When I was younger, and you could masturbate, your body you just did your penis, you know? But now I have a sensation, a different type of sensation where my whole body wants to move. I just want to sit still. I want to go. You know, I want to be, yeah.
I think that's arousal, not necessarily the implant.
Okay. Well, if it wasn't for the implant, I wouldn't have the arousal.
That's very true. Very true. Very true.
If it wasn't for the implant, I wouldn't be where I'm at today.
No.
So.
And just tell me, like, again, we were mentioning earlier that the conversations with your partner and the importance of involving your partner early on, like, how was that for you?
When I told her I was going to have the surgery, she kind of was going, well, you know, are you sure? And I said, look, I'm not doing this for me. I'm doing this for you because I want you to experience something that you said you've never experienced with a man. I want you to know you're being loved, feel you're being loved. I want you to be a part of this, not just for me, but my emotions and your emotions have to coincide with each other. So you have to understand how I feel. And I feel like I'm not a man. And when a man doesn't feel like a man, then he doubts himself in every shape, form, or fashion. That affects his job, affects his walk of life, affects his emotions, his feelings. Everything about him changes. And you don't want that. You don't want to see me change. You want to see me happy. Yeah.
And how has that changed now?
She has seen, or actually we video chatted, and she said, you look like you're just on top of the world. And I said, yeah.
So your demeanor is different.
Everything that has changed. My attitude has changed. My speech has changed. My walk has changed. I walk through my job. I prance because I'm just happy. You know, before I was walking sluggish. You know, my head was down. My shoulders were rolled in. Now, my head is up, my shoulders are back, my chest is stuck out, and I'm prancing. I feel like a Clydesdale. And she notices it. She notices it in my speech. She notices it in my talk. She said, you just seem to be so much happier. And I said, yeah, well, you're going to be on the receiving end of my happiness. So
yeah, we have to record another one after.
So everything that has happened to me is because of what you've done for me. I can't And I will not let anybody say anything different, because I thank you from the bottom of my heart that if it wasn't for you, I would not be the man I am right now.
Thank you for saying that.
That's nothing to be thankful for. It's true. It's all true, because you saved my life. In a matter of speaking, I was dying. Depression, anxiety. I was wallowing. I was sick. You brought me out of that, and I appreciate you. You can't understand how much I talk about you. You have given me my life back, and I will never forget it, ever.
Thank you so much. I first want to thank you, for trusting me with your care. I know it is not easy for you to, give the one organ that we, as men, we truly value in the hands of a stranger, right?
Yeah.
So I truly, thank you for that. So if there's any, like a single piece of advice that you would give others out there, this is usually, most of the time is being seen by other patients, other doctors that are offering treatment options for erectile dysfunction, and patients who are suffering with erectile dysfunction with a similar situation, or sometimes even partners that are looking for solutions for their partners. If there's one single piece of advice that you will give them, what would that be?
Take it. Let him do it.
Doesn't necessarily have to be me, but
Yeah,
see
let
an
him
expert.
do
See
it.
an expert.
Let him do it. If you don't take the step to fix your mental, your physical, and your emotional health by doing this, you're going to suffer more than you will understand. You have to understand, we men pride ourselves on what we do in bed.
Mm-hmm.
When we get finished in bed, we walk around like game hens, okay? Head stuck up, tail stuck out, and our chest is puffed out there big. And when you can't do that, you feel useless. You feel like you're nothing anymore. So any man out there who needs this, do this. I did it. I'm happy.
Any regrets?
None.
Worth it?
Every penny. I would not change this for nothing in the world. When I first started out, yeah, I thought, oh, man. Even after the surgery, and I'm laying in there recuperating in my own bed, and I was laying there going, did I do the right thing? Okay, let me see. Yeah, I don't know. But after the healing process, and I got to actually see what it did, yeah, I'll never regret this.
Okay.
Ever.
If it was something that many guys, like some guys, are concerned about, given that it is a medical device and it can eventually fail, would you go through this process again?
Yeah.
Okay.
Because
usually that's why I tell them, it's like we can always get it back.
well, the process was not that long.
Mm-hmm.
And the fact that I see what it does now, would I do it again? Oh yeah, in a heartbeat. Matter of fact, I'd probably be knocking on your door. I'd be at this door before you guys opened up. and I have been at this door before it opened up, looking in going, is he at home yet? So this is how much you mean to me. Okay, you have changed a lot in my life. I'm 67 years old, and I feel like I'm 18. I feel like I could take on anything. I don't know how to express it more to any man.
Mm-hmm.
If you don't do this, you'll wallow in self-pity. You got to do this. You really do. I wouldn't change it for nothing. Women, sit, conversate with your husbands. Let them understand that you're there,
Mm-hmm.
that you're understanding their emotional plight, because if you really look at it, I never knew you or Dr. Barnes existed. Okay, because there's nothing in the medical field for men. There's everything for women, but there's nothing for men at all. So what do we look for? We can't find it.
There are, fortunately, we have multiple avenues, now online that we try to provide as much education. That's why we have channels like this one and platforms like this
Now.
one in order for us to be able to talk about these
Yeah,
things.
now. But when I had it, no. When I first started out, there was no avenue. I get on, ask my insurance company, is there anything that can be done? Oh, no, you're just getting old. And I'm going, yeah, let me reach this phone. Men need this. Men need to know that there is something medically that can be done instead of them suffering. And this is it. This is the ultimate relief.
Of hope.
Oh, relief, hope. It doesn't matter. They just need it. They need to get it done. And I'm not going to sit here and tell you they don't. I'm going to say yes. You can do it. Don't sit there and suffer, because what you're going to get out of it is 10 times more than you have without it. Well, she will too.
Well, thank you, David. Thank you for your time. Thank you for your honesty. Thank you for opening us or opening yourself to us and for the public, everybody who's listening to us. This is invaluable. Has no value what you're doing right now, and we need guys like you who are willing to speak up. Because again, as a physician, I can talk about others' experiences, but hearing it firsthand from somebody who lived through it, again, has no value. And I truly thank you for your bravery and your courage to speak up about your situation and how a simple procedure, because in the hands of an expert, this is a simple procedure, we can really get your hope back, hope for them back. So thank you for that.
I thank you for being my doctor.
Well, thank you so much.